Dr. Collins. How are you today?
Good morning, Viviane. Yeah, very good. Good to see you.
Thank you for your time this morning. The last time that we spoke, you mentioned a patient, a man with atopic dermatitis who became very distressed when you reviewed him in clinic. As I recall, he's a teacher, but he had taken a leave of absence from work because his symptoms had flared quite badly. And I know that he became very upset that morning with you in clinic about his situation. As I remember, you had treated him with methotrexate and cyclosporin, but he hadn't achieved meaningful control. So you decided to start him on dupilumab following our conversation. I was just wondering, how has that patient responded to treatment? It must be 8 or 9 weeks now since he started.
Yeah, that's right. And actually, Viviane, we saw him in clinic last week and been absolutely delighted with the response. Completely life-changing for that man. And yeah, you're right. I decided to take him off cyclosporin, hadn't controlled his symptoms, and then we commenced treatment with dupilumab only 8 weeks ago now. So I was delighted to see the physical response in terms of his skin clearance. We've had a fantastic response with all patients actually who've been initiated dupilumab. But outstanding at the progress that he's made in such a short amount of time. Don't usually see this prior to Dupixent, so amazing.
Well, that's very uplifting to hear that you've had such a positive outcome for that patient. You mentioned the physical skin clearance that you achieved, Dr. Collins. What other burdensome symptoms was that man dealing with?
Well, in particular, he also mentioned the trouble he had sleeping due to the itch, which is reduced. You know, sleep was a huge problem for him, especially with the nature of the work that he did. And a lack of sleep was always a big issue. It's always a big issue with atopic dermatitis in general, but specifically for him, it was a problem. And he used to mention that off the back of that, his concentration was really poor. So it was a particular problem for him.
And how have these improvements in sleep helped him?
Yeah, well, there's a positive knock-on effect in terms of he used to take quite a bit of time off work. So he's reduced the amount of time that he's had to take off, which has been a huge relief for him. Being able to sleep has given him a real boost emotionally. And a boost in his confidence. And do you know what? Before he used to come into clinic, he wouldn't even maintain eye contact with me. And since then, you know, when I saw him last week, the man that I saw in front of me, you know, it looked like it just come so far. So, you know, some real improvements, Viviane.
Yes, I remember how impacted he was in terms of his work. It must have been such a stressful time for him. I was just thinking, having to deal with the immediate symptoms, but also in the background, having to perhaps deal with the financial impacts, or perhaps worrying about how his absences from work were affecting his employers or, you know, his students' progress. It must have been very rewarding for you, Dr. Collins, to have achieved such a life-changing impact on one of your patients' lives.
Well, yeah, I suppose so. And I very much feel we're in a new era now. We used to only be able to make tweaks, really, in terms of their treatment plan, you know, recycle the immunosuppressants, make very small changes with often limited improvements in terms of outcomes. And now that we've got Dupixent, you know, it's not rare that we see these monumental changes, these monumental improvements in outcomes. And it does give you a boost. You know, these used to be heart sink patients. And now, and we used to run out of options. And now we've got a very good option that's yielding really good results.
Well, it's great to hear that dupilumab has helped you make such a difference to another one of your patients. I think you've seen with all your patients the negative impact that AD can have when it prevents people just doing the normal things in life that we often take for granted. And you've reminded me about a similar patient very impacted by AD, that another consultant dermatologist actually in the Mater Hospital discussed with me recently. And this lady is a young girl. She's due to get married next year, and she has eczema mainly affecting her face. At times her face could clear relatively well on methotrexate, but she was prone to frequent flares. Like your patient, this lady reached a tipping point as she was worried about how she would actually get through her wedding day. Her confidence was very badly affected, and she was dreading everyone staring at her the day of her wedding. And unfortunately, it was affecting her choice of dress. She didn't like to be in photos, so she felt then that she was impacting on everyone around her. It made me think, about how this girl should be enjoying the excitement of planning her wedding, but instead, actually, she was planning her wedding around her atopic dermatitis. And just, I suppose, trying to get through what should have been one of the happiest days of her life. I'm sure you can imagine how stressful it must have been worrying about this all of the time, and the lack of control that she must have felt. And the consultant said actually that he hadn't really thought of dupilumab because the visual symptoms and easy scores for this lady weren't, as he described it, too bad. But interestingly, this lady's DLQI score showed that she was very similar to your patient in terms of how atopic dermatitis was impacting her life. Again, the consultant changed this lady's life when he prescribed dupilumab. After a number of weeks, her DLQI score had dramatically improved. When I spoke with him, he said he found it hugely rewarding to think that he could improve her symptoms, but also give her back, I suppose, some joy in her life. What I found interesting is that he mentioned her goal was just to be normal, and he had helped her reach this goal. And it made me think, so what are your patients' goals, Dr. Collins, when you discuss treatment options?
Yeah, well, very similar, Viviane. There's lots of individual patient stories out there, and each patient has different goals. Most of them just want to be normal or to feel better, and just be able to live a normal life. But every patient's different. Some, as you've described there, might have limited skin coverage, but it's really, really important to reduce the surface area coverage, especially if it's visible on their face or their hands. Some aren't that bothered about the skin appearance, but just want to some relief from the relentless itch. It differs from patient to patient, but yeah, each patient with atopic dermatitis feels quite a significant burden in some way, and has a goal to reduce that.
And what are your goals, Dr. Collins, when you are deciding what treatment to commence with a patient?
So I would like to align with my patient goals, but also for me, clinically, it's really important to reduce that skin coverage. And most of the patients that I've initiated have high EASI scores, probably well above 30. So it's important to reduce that, but also try and switch off the itch so they can sleep better, and hopefully align some of the individual patient goals that they discuss with me. So
looking at these two patients on presentation, it's interesting that both had very different EASI scores, but both were equally distressed about the impact of their disease. And they had similar goals. They just wanted to be normal and get on with their lives. Unfortunately, what was stopping them reaching their goals was that they weren't achieving long-term control on systemics. Are you surprised, Dr. Collins, that approximately 3 out of 5 patients are inadequately controlled on systemic treatments?
No, not really. This is something we've been battling for years prior to Dupixent. I think you could get short-term control with systemics, but after years of patients suffering and us trialing different therapies, then unfortunately there is a fairly high percentage of patients that are uncontrolled on their current therapy.
Well, today, Dr. Collins, if it's okay with you, I think it might be worth exploring perhaps some of those patients that you have in your clinic who perhaps, don't have a very high easy score, but perhaps are, very impacted in terms of what you're seeing with their DLQI scores. And I suppose, patients who are maybe perhaps more moderate in their physical symptoms, we know that psychologically the burden of atopic dermatitis is high. And perhaps we could look at trying to identify some of those patients who may be really impacted by their AD.